All right, guys, now we're going to get into Chapter 6, Eye and Ear Assessment and Procedures. So let's start on page 180. I need you, under the introduction to the eye, you need to highlight where it says the medical assistant is responsible for performing a variety of assessment and procedures that involve the eye. You do need to highlight where it says irrigation and installation. Please highlight both of those sentences. Irrigation is washing a body canal with a flowing solution. Installation is dropping a liquid into a body cavity. Now we're going to go on down to structure of the eye. The eye has three layers. The outer layer is the sclera, which is composed of tough, white, fibrous connective tissue. The front part of the sclera is modified to form a transparent covering of the colored part of the eye. This covering is the cornea. All that needs to be highlighted. The middle layer of the eye is the choroid, which is composed of many blood vessels and is highly pigmented. The blood vessels nourish the outer layers of the eye, and the pigment works to absorb stray light rays. The front part of the choroid is specialized into the ciliary body, the suspensory ligaments, and the iris. The ciliary body contains muscles that control the shape of the lens. This function of the suspensory ligaments is to suspend the lens in place. The lens is responsible for focusing the light rays on the retina. That needs to be highlighted. The colored part of the eye is the iris, which controls the size of the pupil. The pupil is the opening of the eye that permits the entrance of the light rays. The third and innermost layer of the eye is the retina. Light rays come to a focus on the retina and subsequently are transmitted to the brain by way of the optic nerve. That needs to be highlighted. You also need to highlight where it says the conjunctiva is a membrane that lines the eyelids and covers the front of the eye except the cornea. If we go on over to page 181 where it says visual acuity refers to acuteness or sharpness of a vision. That needs to be highlighted. You also need to highlight where it says refraction refers to the ability of the eye to bend the parallel light rays coming onto it so that they can be focused on the retina. That needs to be highlighted. A person who is nearsighted has a condition termed myopia. That needs to be highlighted. A myopic person has difficulty seeing objects at a distance. If we go on over to the other side of page 181, a person who is farsighted has a condition known as hyperopia. That needs to be highlighted. The individual has difficulty viewing objects at a reading or working distance. That needs to be highlighted. We go down to the very last sentence right before eye specialist, where it says this condition, presbyopia, results in a decreased ability to focus clearly on close objects. That needs to be highlighted. Eye specialist. If a defect in visual acuity is detected, the patient is referred to an eye specialist for further evaluation. Several types of specialists are involved in the care of the eyes. An ophthalmologist is a physician who specializes in diagnosing and treating diseases and disorders of the eye. An ophthalmologist is qualified to prescribe ophthalmic and systemic medications and to perform eye surgery. An optometrist is a licensed primary health care provider who has experience in measuring visual acuity and prescribing corrective lenses for the treatment of refractive errors. An optometrist is also qualified to diagnose and treat disorders and diseases of the eye and is to prescribe ophthalmic medications. An optometrist is not a physician and is not permitted to prescribe systemic medications or to perform eye surgery. An optician is a professional who interprets and fills prescriptions for eyeglasses and contact lenses. All of that needs to be highlighted. Assessment of distance visual acuity. Myopia can be diagnosed in combination with other tests by a distance visual acuity (DVA) test. In the medical office, the Snellen eye chart is the most often used. That needs to be highlighted. It's going to go down a couple of sentences, and you need to highlight where it says the other type is used for preschool children, non-English speaking people, and non-readers. It is composed of a capital letter E in decreasing sizes and arranged in different directions. If you go to page 182, there are a couple of examples of the Snellen eye chart and the Snellen Big E eye chart. Under conducting a Snellen test, you need to highlight where it says this test is usually performed at a distance of 20 feet. On the other side, on page 182, you also need to highlight where it says two numbers separated by a line appear at the side of each row of letters on the chart. The number of line represents the distance in feet at which the test is conducted. It is usually 20 feet because most eye tests are conducted at this distance. The number below the line represents the distance from which a person with normal vision acuity can read the row of letters. The line marked 20/20 indicates normal distance visual acuity or 20/20 vision. This means a person can read what he or she is supposed to read at a distance of 20 feet. Visual acuity reading of a 20/30 means that this is the smallest line an individual can read at a distance of 20 feet. All of that needs to be highlighted. If we go on over to page 183, the couple sentences right above where it says assessing distance visual acuity in preschool children. You need to highlight the part where it says the patient should be instructed to leave open the eye not being tested because closing it causes squinting of the eye that is being tested. We go down to assessment of near visual acuity. Near visual acuity, NVA testing assesses the patient's ability to read close objects. That needs to be highlighted. If you go on over to the second sentence under figure 6.5 on page 183, you need to highlight where it says it is conducted with the patient holding the test card at a distance between 14 and 16 inches. If we go on over to page 184, you need to highlight where it says under the assessments of color vision, defects in color vision may be classified as congenital or acquired. Congenital defects are more common and refer to a color vision deficiency that is inherited and is present at birth. Congenital color vision deficiencies most often affect males. That part needs to be highlighted. If we go over to page 186, you need to be familiar with figure 6.7. Some of you may have already even done that test, but if you haven't, it's good to kind of know about that. A lot of doctors use that. If we're going to go down on page 186, it's going to be the second paragraph, or you may consider it the third. You need to highlight where it says plates 1 through 11 are used to conduct the basic test, and plates 12, 13, and 14 are used to further assist patients who exhibit a red-green color deficiency. That needs to be highlighted. If we go on over to page 188 in figure 6.2, you need to highlight under number 3 the procedural step, the very last sentence where it says tell the patient that 3 seconds will be given to identify each plate. If we go over to page 189 under figure 6.2, number 8, please highlight where it says the book of color plates must be stored in a closed position to protect it from light. Exposing the plates to excessive and unnecessary light results in fading of the color. That needs to be highlighted. If you go over to 190 on page 190 under eye installation, eye installations are performed to treat eye infections. That needs to be highlighted. If we go over to page 192 under procedure 6.3, please highlight on number 8 where it says gently release the solution onto the eye at the inner canthus. And if you look, you see one where the doctor is putting a cotton ball, kind of blotting, cleansing the eyelid from inner to outer. And then on the other side, you see separate the eyelids and hold the tip of the syringe 1 inch above the eye. But if you look, he's actually looking, starting at the inside. Okay, on page 193, under procedure 6.4, you're going to highlight this part on number 7. Gently squeeze the container and place the correct number of eye drops in the center of the lower conjunctival sac. Never place the drops directly on the eyeball. Replace the cap on the container. That needs to be highlighted. And then if you look on page 194 on procedure 6.4, you need to highlight the part where it's asked the patient to look up and insert the medication. Introduction to the ear on page 194. An odometer is an instrument that emits sound waves at various frequencies. The patient is instructed to indicate when a sound at a given frequency can be heard. That part needs to be highlighted. It is the last 2 sentences on the second paragraph. Now we're going to go over to the structure of the ear. You need to highlight the auricle is a flap of cartilage covered with skin that protects from the side of the head. Its function is to receive and collect sound waves and to direct them toward the external auditory canal. That needs to be highlighted. In the next paragraph, you need to highlight the part where it says the glands secrete earwax or cerium, a yellowish waxy substance that lubricates and protects the ear canal. On page 195, the tympanic membrane is at the end of the external auditory canal. It is a pearly gray, semi-transparent membrane that receives sound waves. That needs to be highlighted. A eustachian tube connects the middle ear to the nasal pharynx. That needs to be highlighted. The semicircular canals also are located in the inner ear and help to maintain equilibrium. That needs to be highlighted. Under the assessment of hearing acuity, the second paragraph, the first sentence needs to be highlighted. An individual with normal hearing should be able to hear the frequencies of normal speech, which range from 300 to 4,000 Hz, hertz or cycles per second. That needs to be highlighted. If you go over across on the other side of 195, types of hearing loss. There are 3 types of hearing loss: conductive, sensorineural, and mixed. Conductive hearing loss results when there is a physical interference with the normal conduction of sound waves through the external and middle ear. That needs to be highlighted. On page 196, you need to highlight where it says in the first paragraph, I believe it's going to be the second sentence, conductive loss in the middle ear may be caused by serious otis media. That needs to be highlighted. You need to highlight where it says the sensorineural hearing loss, SNHL, results from damage to the inner ear or auditory nerve. That needs to be highlighted. Down a couple of sentences where it says specific causes of sensorineural loss, including hereditary factors, degenerative changes from the normal aging process known as presbycusis, intense noise exposure over time, tumors, toxicity caused by certain medications, and infection diseases such as measles, mumps, and meningitis. All of that needs to be highlighted. You need to highlight where it says the tuning fork test, where it says the Weber test and the Rhine test. All of those meanings need to be highlighted. On page 198, you need to highlight the very top where it says audiometry is a more specific hearing acuity test because it provides information on how extensive a hearing loss is and which frequencies are involved. Under the tympanometer, the very last part where it says, is useful in diagnosing serious otis media fluid in the middle ear. On page 199, under ear installation, the second sentence, ear installations are performed to soften impacted serum to combat infection with the use of antibiotic ear drops and to relieve pain. That needs to be highlighted. On procedure 6.5, page 201, you see what the tray looks like being set up for an ear irrigation. On page 202, you need to highlight number 8 on the procedural step, and number 10 where it says principle. The tip of the irrigating device should be directed at the root of the canal to prevent injury to the tympanic membrane. That needs to be highlighted. Page 204, procedure 6.6, you need to highlight number 9. And that concludes chapter 6.